How do our patients access drugs? Basically, 2, 3, or 4 means. We began with unused prescriptions. Then, antiretroviral therapy were luxury. Only few could afford those drugs in the year 2000 in Nigeria. But I know that I saved so many lives through the use of unused prescriptions that were sent to us. And later on in the year 2003, a friend of ours, Saleh, came over and saw my patients dying daily, and she was touched. And so she set up a program called Save a Life Program. Then it cost $500 a year per patient, per treatment. This, over the years, has now fallen to about less than $200 per year per patient. What it means is that each individual can sponsor a patient on medication for less than 50 cents per day. So we have about 150 patients on these 2 programs, unused prescriptions and also Save a Life program. And the third one, Otto Aman, when he came around, he saw that health workers who were infected with HIV and AIDS didn't have automatic HIV/AIDS treatment. And so he is sponsoring about 25 persons who are health workers who are infected with HIV and AIDS. And then the fourth one is the PEPFAR program, the President Bush Emergency Plan for AIDS Relief, where the United States government is providing drugs for about 2,500 patients. So altogether, all these programs have about, and then the Mennonite Central Committee also sponsors about 500 patients. So altogether, on the average, we have about 3,000 patients on antiretroviral therapy, leaving about 10,000 waiting for drugs. This is enormous. And the reason is that we can't put all 10,000 on drugs without evidence that they can be sustained on these drugs for life. So the number that are on drugs are based on the fact that they need the drugs for life. So 10,000 on the waiting list for drug. What a tragedy. The decision as to who gets medication depends on a number of factors. First, pregnant women and children are given preference. And the reasons are obvious. When you're dealing with a pregnant woman, you're dealing with 2 human beings. Next, you look at health workers, because some of them must have gotten the virus through some occupational health hazards. So you consider the doctors, the nurses, the lab technicians. Next, you look at people who have ambitious career, the nurse, the doctors, or persons who are willing to share the prevention HIV/AIDS message. And then maybe the pastors, the imams, is a difficult decision. But then the medical criteria may also come in. You consider their health status, CD4 count. So in summary, there are social reasons, there are medical reasons, there are cultural reasons, there are economic reasons. It's a difficult decision. And every day we continually face this difficult decision as to who next should be on medications. You may ask, is Faith Alive the only center treating for HIV and AIDS? No. But the difference is that everything here is basically free. So all the other centers that treat for HIV and AIDS, you may have to pay something along the line. So patients who are poor insist that they rather remain in Faith Alive and die than to go to somewhere they cannot afford anything. You see, the word about how we help our patients is trying to generate hope in them. Here is a disease, HIV/AIDS, that is not curable. And even is treatable, but not many have access to the drugs. So what do? We have to generate hope. You see, one way I encourage them is that none of us can tell when he or she will die. Those who are sick die. Those who are well die. So I tell them, the fact that you are sick does not mean you are going to be the next person to die. No one can tell. So live the life that God has given you normally. If God gives you 1 day, live it for him. If God gives you 100 years, live it for him. Secondly, I look back Some years and years ago, there were so many incurable diseases, leprosy, tuberculosis, even malaria. But today, they are curable. So I tell my patients, today, HIV and AIDS may not be curable, but tomorrow, there may be a cure. So live, hoping that the cure will come tomorrow. So we try to generate hope. Sometimes they come with guilt that they are paying for their sins. And I tell them, no, the holy people die. The sinners die. Everybody dies. And I tell them, Lazarus was the best friend of Jesus. It was sickness that killed Lazarus. So that you are sick does not mean you are the greatest sinner. Anybody can be sick. Be you a Christian, be you a non-Christian. But what we should aim at is to gain eternal life.